responsiveness in coming to this committee. I think it's pertinent and very timely that we hear from the Minister on what Canada is doing regarding the COVID-19 vaccine export control measures put in place by the European Union on Friday. As I understand, Canada was not explicitly listed as a country which is exempt from these measures, unlike nearly 120 other countries. We also can't forget that our approved Pfizer and Moderna vaccines are shipped from Belgium and Spain, respectively. I hope to see all members of our committee support this motion due to the importance of this issue. And so therefore, I'd like to move that given the announced transparency and authorization mechanism for exports of COVID-19 vaccines in the European Union, the committee invite the Minister of Small Business, Export Promotion and International Trade and her officials to appear before the committee for no less than 2 hours regarding matters related to the European Union's export controls and its potential impacts on Canada's COVID-19 vaccination strategy. And this meeting will occur no later than February 10th, 2021.
Okay, thank you very much, Ms. Gray. Ms. Bedian, please, Parliamentary Secretary.
Thank you, Madam Chair, and I would like to thank all of the colleagues on this committee, and in particular thank the Conservative member who has raised this important issue. Obviously, we have been working around the clock over the weekend, and I have, in parallel to that, been working in order to secure the Minister's appearance before this committee at the earliest possible opportunity. We are Monday morning, and I'm pleased to advise all committee members that the Minister is available to appear immediately after this discussion. And so I would invite colleagues, unless they have any urgent matters to raise in connection with this debate, that we move quickly to hear directly from the Minister.
We'll go now to Dr. Bogoch. Please go ahead, 6 minutes.
Thank you so much. Good morning, everyone. My name is Isaac Bogoch, and I'm an infectious diseases physician and scientist based out of the Toronto General Hospital and the University of Toronto. Thank you for inviting me to speak at this committee meeting regarding the COVID-19 second wave in Canada. The focus of my few minutes is to discuss an exit strategy from this wave and from the pandemic in general, with an emphasis on vaccination, but also touching on other issues, including non-pharmaceutical interventions. The ultimate goal here is to halt our second wave and to prevent further waves of COVID-19. Now, most regions of Canada have emerged from peak cases in December or early January and are seeing a steady decline or a plateau in cases due to our current control initiatives. While this is laudable, we still have a long, long way to go. Vaccines are trickling in, but we won't really be able to start massive expansion of these programs until the spring. So programs are appropriately focusing on those at risk or greatest risk of severe outcomes. I want to touch on 3 big topics: what's working in our favor, what is working against us, and how do we navigate the winter and the spring and beyond. So let's start with what's working in our favor. Number 1, we have vaccines. Of course, the current short-term slowdown is preventing expansion of these programs, but we still have some, and we're making good use of what we've got. Just to state the obvious, the sooner we ramp up these programs, the better. All vaccines approved by Health Canada and those under consideration have excellent efficacy against the virus, including the variant discovered in the UK, while there is lower efficacy on other variants of concern, for example, the one discovered in South Africa. However, the vaccines still appear to reduce infection, prevent severe illness, prevent hospitalization, and prevent death. All very important metrics. The second thing working in our favor is weather. Believe it or not, weather in Canada is actually working in our favor. As we leave winter, as we enter the spring and summer, warmer weather means less contact in indoor settings where the vast majority of virus is transmitted. These fewer high-risk contacts add up at a population level and are going to help. The third thing is that our current public health measures are working in much of Canada, and in general, Canadians are adhering to them. So what's working against us? Number 1, the variants of concern. For example, the variant discovered in the UK, that's the B.1.1.7 variant, is more transmissible and has a strong foothold in Canada. We have to respect this, we have to take it seriously, and we need to drill down on our current control efforts until vaccine rollout is more widespread. The second thing working against us is anything that jeopardizes vaccine delivery. This is way above my pay grade, and I'm going to leave it to you to sort that out. The third thing is vaccine hesitancy. This is pronounced in some communities, but it's still important and we have to address it. Number 4 is targeting misinformation and focusing on better communication, both from official and non-official sources. This is beyond the scope of my time, but it's still a huge problem that's impacting the pandemic in Canada and beyond. Number 5 is COVID fatigue. It's real, it's permeating all aspects of Canada, and we can't let our guard down, especially as we see a finish line on the horizon. So lastly, how do we stick handle our way through the winter and into the spring and beyond? First, we need to be very, very careful and have a careful and measured reopening strategy, especially while vaccines are slowly being rolled out. The variant discovered in the UK will make this more challenging, but it can be done. It's foolish to lift public health measures if the drivers of community infection are not addressed. Vaccine rollout will not be widespread until the spring. There's no point having more lockdowns. Lifting measures has to be done at the right time, slowly and carefully. Related to the point above is creating safer indoor environments, and that includes schools and workplaces for essential workers and those returning to work. That means integrating rapid diagnostic tests or rapid screening tests, improving ventilation in these settings, smaller class sizes, wraparound services to ensure equitable access to safety and protection, etc. The third thing is vaccine distribution. Now let's separate politics from science for a second. It may be an unpopular political opinion, but it makes medical, scientific, and public health sense to divert vaccines from low-burden areas of the country that are able to control the virus to more heavily impacted areas while there is still a shortage. Number 4 is vaccine supply in the short term. Health Canada has to conduct their evaluation independently, but the faster we vaccinate, the faster we're out of this mess. Johnson & Johnson, Novavax, AstraZeneca are 3 products with excellent phase 3 clinical trial data. We have contracts with them, and they are sorely needed. And lastly is a long-term strategy. It's crucial to support Canadian scientists and Canadian industry in homegrown vaccine production. This is a major weakness and a major health security issue. We have the talent and capability here, and it's long past time to enhance and expand these programs. It's hard to sum up all that's required to strategically navigate the second wave in 5 minutes, but I hope we can continue this conversation, and I thank you for your time.